Congresswoman Houlihan, how would this program work? How fast could you get it going?
So thank you very much for having me. And this program would take a page out of the AmeriCorps model that already is up and going. We already have the systems in place to do this. Effectively, what it would do is it would take some of those folks that are frankly already sidelined from AmeriCorps, Peace Corps, other service organizations like that, and it would redeploy and reskill and retrain them, and it would augment them as well. And those folks would be the boots on the ground that would do the tracking and testing and tracing and hopefully even the treating in terms of inoculation and vaccination alongside of the already existing community support networks and the already existing professional healthcare providers as well. We just need a lot of people, as you mentioned, to be able to run a national or nationwide testing strategy. We need the tests, but we also need the workforce.
Let's listen to what Senator Elizabeth Warren said today in that Senate hearing about what is at stake in contact tracing.
There are many things the states can do by themselves, and God bless them. They're out there trying to do it every day, to open more emergency hospitals and to do all kinds of work to try to keep their citizens safe. But contact tracing, we move. We move from place to place and state to state. This is something that needs national leadership.
Dr. Anthony Fauci said in response to that we would, of course, have more infections and more deaths without adequate contact tracing. So this is a matter of life and death. And you've got a bipartisan group supporting this bill, don't you?
We do. And you mentioned that I'm a veteran. I also happen to be an AmeriCorps person as well. This bipartisan group who are in support of this happen to also have heritages and backgrounds of service as well. And we have a really eclectic group of people who really genuinely believe that we do need a national testing strategy. We do need a unified national testing strategy, and that this is a really good way to ramp up the number of people we have to be able to do that as quickly as possible.
Is there something about military experience that gives you the notion that we can start from zero and build something very quickly?
Absolutely. It's a combination not only of my military experience, but also, as I mentioned, of my service background in the AmeriCorps organization as well. We know what is possible. We know that we can do it together. We know that Americans are genuinely generous people, and they're looking for ways that they can be helpful right now. And they're also, frankly, as you mentioned, looking for skills and job training that will allow them to be able to join this new economy. We don't really know what the new economy is going to look like, but we certainly know that we're not going to be able to open our economy safely without something like national testing and tracing and tracking. And so this is absolutely within the realm of the possible. We are a nation of open-hearted people, and national service is something that we're all very much called to. You've seen that in what's happened in our nation over the last 5 or 6 weeks, our real answer to the call to serve and to help.